I guess I was sort of a late bloomer. I didn't really realize until my mid-20s that what I was doing at the time wasn't where I wanted or what I felt was where I was supposed to be. So I was working retail management, and I got to a point where I knew there was something else I should be doing. And so speaking with several friends that were in the medical field, I wasn't quite sure at the time, but a good friend of mine said, "Why don't you try nursing? You can go through a nursing career." I wanted to have a career that I knew that I was helping someone, and I wanted my career to, like I said, I just wanted to be able to help somebody and make a difference in their lives. So that was really one of the big reasons. Initially, I had a bachelor's degree in biology from Southern Illinois University at Edwardsville. I didn't really use that too much, and it wasn't, like I said, until later when I went back to school. I went to Chamberlain University through a advanced program that basically was about a year and a half for nursing. And then I worked in critical care as a nurse before going back to Maryville University to get my advanced practice degree. So I started working at Memorial about a little over 4 years ago. I grew up in the Midwest, so I had friends that actually worked at Memorial that always recommended the hospital, and I knew that it was a good hospital to work at just from speaking to others. So basically, yeah, it's just kind of word of mouth. And then at the time I was working in Granite City at a hospital in the ICU before I came over here to Memorial. When you have a vascular patient, you have a vascular patient for life. Although they may be, you're seeing this patient or meeting them later in life, you're going to treat them for the rest of their life. So it's really developing a relationship, getting to know them. That's one of the things I love about medicine. It's just relationship building, being able to really help, the patient live a better life. To be able to, especially with vascular diseases, they can be very painful. With arterial diseases, patients, at one time they could walk 2, 3, 4 blocks with no pain. These issues can cause a lot of pain. So being able to know that you're making a difference and that you can improve their quality of life, it's a pretty good feeling.